Hello everyone, and thank you for joining us today for the virtual launch of MazikCare from Mazik Global. MazikCare is an EMR/EHR solution built on Microsoft Dynamics AX 2012 and designed under CCHIT and HL7 guidelines. MazikCare is a solution that encompasses both the provider and the patient to help achieve goals, from better care to more effective financial practices. With deep expertise in enterprise resource planning and the health sector, Mazik is best positioned to address the demands of healthcare IT, getting the right information in front of the right people in the right way at the right time. My name is Lane Koreska from Mazik Global, and today I'm going to walk you through the functionality of MazikCare so that in the short time we have today you can get a sense of how MazikCare helps healthcare organizations meet all patient management, collaborative care, billing, accounting, resource planning, and system integration needs with a global enterprise resource planning solution customized for the demands of organizations within the healthcare industry. MazikCare is an EMR with functionality specifically designed for hospitals and clinics and long-term care facilities, functionality designed to connect and strengthen all arms of a healthcare organization. I'm going to demonstrate that functionality today by taking you through a typical day in the life of an organization using MazikCare. So what we're looking at right now is the role center. MazikCare is a role-based solution, so it will actually affect the capacity and functionality that a user has depending on what their role is. Right now we're looking at this from the perspective of a physician, Dr. Phillips Brown. So here we can see all of his appointments for the day, we can see what's scheduled by the week, month, and we can also see a timeline as well. We can also see any reports or health news that the doctor is going to subscribe to. So to show you the way the patient intake process works, we're going to be jumping around from role to role. We're going to start not with the doctor, but we're actually going to start with the receptionist, who's going to schedule patient appointments for the day. So we'll jump into MazikCare Ambulatory, and we're going to select Visit Appointments because this is really what her area is going to be primarily concerned with. So we'll select the physician and the clinic that she's working with for the day, and this will show us the ledger. Now the ledger is really key because anybody who's working in this clinic needs to be able to see who's where in the process. To answer this, we have a color-coded system that allows nurses and doctors and receptionists to see exactly where a patient is at any given time in the patient intake process. So here you see we have a couple of different examples, one purple, one yellow, signifying that one patient is checked in, one patient is checked out. And so we'll get into this a little bit more, but just really quickly, that's just one of these great little touches that MazikCare has with it that really lends itself to being a very intuitive and usable system. So let's say that the receptionist is working and she gets a call from a patient who wants to schedule an appointment for today for 11 a.m. So all she has to do is select 11 a.m. and then go to Visit Appointments, and she'll select our patient for the day. Now the person calling is Mr. Steve A. Ball, so we'll go ahead and select him. And here the receptionist can see his MRN number, his gender and age and address and contact information all at a quick glance. So she knows that that's the patient that we want to work with today, so she will go ahead and select him. For schedule type, this is a new appointment, so she'll go ahead and mark that. And under notes, she'll mark the reason for the visit, which is that the patient is complaining of chest pain. So we'll go ahead and mark that, and then we'll very simply schedule the appointment. So you can see that it's open, it's not color-coded in any way, that's because the patient hasn't yet arrived. Let's say that 11 o'clock does go ahead and roll around and we can check the patient in. So when the patient arrives, we'll just go ahead and mark that, and then we'll check in Mr. Steve A. Ball. Now you can see that his color has gone to yellow, signifying that he's checked in, but he's not yet in the examination room. So when the nurse is looking at this ledger, that's her key to take over. So we'll go ahead and jump. So the nurse is logged in and she sees the common screen. So what she's going to do is she's going to select Visit Appointments to take a look at her ledger for the day. She'll select the physician and the clinic, and then she'll just see who's scheduled for the day. Right now she sees our patient, Steve Ball. He's checked in, but he's not yet in the examination room. So that's the nurse's cue to go ahead and move him into the examination room by beginning an encounter. So creating a new encounter is very simple. All she has to do is select the reason for the visit, which is chest pain. And if the nurse learns anything additional about the visit, she can go ahead and enter this here. So we'll say the patient is suffering minor chest pain on the right-hand side. We'll go ahead and create the encounter. And you can see that the color changed, and this brings us into the encounter screen. Now the encounter screen is really critical for the nurse and for the doctor because this is where we'll be really seeing the heart of the patient process. So here we have our vital signs and our allergies and our health maintenance reminders. For vital signs, the nurse is going to record all of the vital signs for the patient. So for diastolic blood pressure, we'll say 95. For pulse rate, we will say 80. Systolic blood pressure, we'll say 145. And for temperature, our patient has a little bit of a fever today, we'll say 101. Also,